Welcome back to the latest episode of Taking Charge of My Cancer podcast, and I have a very impressive guest today. I've been looking for this for a while. This is Dr. Sharon Byun. I'm saying it right?
Yes.
Okay, perfect. She is a board certified in obstetrics and gynecology and lifestyle medicine, and is a fellow of the American College of Obstetrics and Gynecology and Diplomate of the American College of Lifestyle Medicine. In addition, she is a Menopause Society certified practitioner. She received her undergrad degree in biomechanical engineer from Boston University and her medical degree for Temple University. She completed her residency training at Thomas Jefferson University in Philadelphia, which she served as administrative chief resident. With a wealth of experience and a 17-year career spent in academic medicine, where she trained students as a faculty member at the University of Pennsylvania and Florida, she was recognized of her excellence as an educator and as a 3 times recipient of the Council of Resident Education and Obstetrics and Gynecological National Faculty Teaching Award. Additionally, she serves as a former oral board examiner for the American Board of Obstetrics and Gynecology. She decided to become board certified in lifestyle medicine because she believes that the pillars of lifestyle medicine can help any motivated individual take control over and improve their health with appropriate guidance. She has personally found better health and fitness in her 50s than she had in her 20s and 30s, and is passionate about using evidence-based lifestyle change to help you achieve your health goals. She also knows that life's transition into menopause can be a time of confusion for many women who often hear conflicted information about how best to navigate this time in their lives. As a certified menopause practitioner, she has additional skill and knowledge that complement her experience as an OBGYN to help to make decisions that are right for you. Beyond her medical expertise, she is a competitive age group triathlete who began her foray in triathlon at the age of 43. She proudly represents the United States at international competitions for Team USA and is a multiple-time age group All-American ranking into the top 10% of her age group nationality. She is also a multiple-time Ironwoman All-World athlete ranking in the top 7% of athletes in her age group. My goodness, Dr. Byun, and I can keep talking about how impressive your life has been, but thank you again for being part of this show.
Well, thank you for having me. I really appreciate it.
Absolutely. So, what led you to expand your practice from traditional gynecology into wellness and integrative medicine?
Yeah. So I actually retired from my academic medical career in 2021, and I really had no intention of resuming my career, let alone becoming board certified in another specialty or starting a new medical practice. But as you know, I had the good fortune of learning about lifestyle medicine actually from one of my now partners, who's Dr. Anna Maria Young. Lifestyle medicine emerged as a relatively new specialty back in 2004 as a way to focus on evidence-based behavioral lifestyle change to prevent and reverse chronic medical conditions such as high blood pressure, diabetes, high cholesterol, and obesity. The specialty focuses on 6 pillars of behavior. So a plant predominant nutrition, physical activity, sleep, stress management, social connection, and avoiding risky substances. And I personally had transitioned to a whole foods plant predominant diet back in 2021. And I was already living an active lifestyle by training for and competing in triathlon. So, once I stopped working 24 plus hour shifts as an obstetrician, I was also able to improve my sleep regularity, duration, and quality. And so, really, the practice of lifestyle medicine was one that I was already living, and I really felt like it was the perfect specialty to integrate into a new career.
Oh, wow. That's a big change, right? I'm sure a scary change. You just go jump from one to the other, right?
Well, it wasn't an abrupt transition. You mentioned my triathlon activities, and in the year and a half after I stopped working, I did 5 half Ironmans and an Ironman. And so
Wow.
that sort of became my quasi full-time job before Dr. Young and I started to pursue our second careers in lifestyle medicine. So really, this process started in 2023 with us getting board certified and then opening our practice in 2024.
Great. That's awesome. And it's so great to have a practice like that here in town close to us. So it's really nice to have that because it's not that many physicians here in Gainesville, at least, that do what you guys do right now, correct?
Correct. And I think that in the state of Florida, as far as I know, we're the only multi-specialty lifestyle medicine practice where the providers within the group have a variety of primary specialty certification. So a lot of people in lifestyle medicine have a primary care background.
Right.
Obviously we have a family medicine physician, a pediatrician, but then with an oncologist and an OBGYN, we really feel like we capture a very broad scope of specialties to really help to address, the needs of our patients.
Got you. So, was there a personal or professional turning point that made you embrace this more holistic approach? You kind of already mentioned your triathlons and your personal activity, but what was that point that you felt like something else was kind of missing?
Right. Well, interestingly, as you mentioned, I didn't start doing that until I was 43. And, I think as is the case for many people with young families who are focused on their careers, personal health and fitness kind of take a back seat when you're juggling a busy schedule. And for me, I actually was quite sedentary and eating a lot of unhealthy food on the go in my 20s and really into my early 40s. And I used to say that I was on a plastic wrapper diet because so much of what I was eating was ultra processed, prepackaged. It was convenient and affordable, and quick to prepare. I just throw something in a microwave, but it was super, super unhealthy. So for me, really, the turning point was we moved to Gainesville from Philadelphia in 2009, right after I turned 40. And, I joined a gym at that point, started working out again, even started working with a personal trainer. So the physical activity started, and then the better nutrition followed from that. Um, Eventually I transitioned to plant-based nutrition. And then, when I was working as an OBGYN, a lot of my patients would say, what do you do to stay so healthy? And I really enjoyed imparting that type of advice on how to be active and eat better. And, there's so many great advances in medical care and modern medicine, but we also know that physicians receive little to no education on healthy lifestyle in medical school and residency. And really, it was only after I learned through changing my own behaviors, which again weren't really until my 40s, that I became better at educating my patients on how to be healthier.
That's amazing. And then how do you feel that this wellness medicine in the context of women's health? Because now we're going to this perimenopause and menopause, right? That's kind of like
Right.
a lot of us, at least me, or a lot of my patients as well, kind of either going through this or they've been put in an early menopause because they're endocrine therapists due to breast cancer. So how do you see that into the women's health world?
Yeah, so, interestingly, I wrote a blog for USA Triathlon several years ago entitled Pursuing Wellness in the Multisport of Life. And then I subsequently gave a lecture to faculty at UF on the same topic. And, to me, wellness is defined as a quality or state of being healthy in body and mind. And that's different for everybody. And obviously, it depends on different circumstances as well. You're not going to necessarily feel immediately well following a cancer diagnosis or while undergoing treatment. So, a lot of it is mitigating the stress through different strategies. But the key common component, I think, for achieving wellness is through deliberate effort. It doesn't just happen to you. You have to be an active participant in making it happen. And back when I wrote the blog and gave the lecture, I described how to incorporate wellness into a person's life. In the form of a prescription. And this is before I knew anything about lifestyle medicine. But now I use the six pillars of lifestyle medicine really as a guidepost to define wellness medicine, and not just for women, but for men also. I'm actually also seeing men for the first time in my career, and I'm really enjoying caring for
Okay,
both.
that's awesome. That's really
Yeah.
good to know. Um, do you think that the stress impact hormone and reproductive health?
So yeah, and as you know, stress is very complicated. I mean, it's not just, it's physiologic, it's psychologic. The hormonal response is regulated by a lot of different systems in our body. So, one of them is the hypothalamic pituitary adrenal axis or the HPA axis. And a lot of it starts in the brain. So, it's a lot, it's psychologic, physiologic, but all connected. So, the hypothalamus and the pituitary gland are in the brain. And then they send signals to the adrenal gland, which is a gland that sits on top of the kidneys. And the adrenal gland produces stress hormones. So, cortisol, epinephrine, which is also known as adrenaline, and norepinephrine. And these hormones interact with the autonomic nervous system, primarily the sympathetic nervous system, which is the fight component of the fight or flight response to stress. And then, when it comes to reproductive health, this system is also regulated by the hypothalamus and the pituitary, signaling down to the gonads. So for women, the gonads are the ovaries. For men, it's the testes. Um, but in terms of stress and reproductive health, you have to keep in mind that there are over 50 hormones that are produced in the human body that serve as chemical messengers that affect a wide variety of functions, and they don't operate in isolation of one another. There's a lot of interconnection, and really our bodies are designed to keep our hormones in balance. It's called homeostasis, and the HPA and the HPG axes are just two of the systems in our body that work through feedback loops to help keep things in balance. So, hormones not only regulate sexual and reproductive function, but also metabolism, blood pressure, blood glucose levels, electrolyte balance, and body temperature. They affect our hunger and our thirst and our feeling of fullness. They affect growth and development, and they also affect sleep and mood. So, when it comes to stress, a classic example in women where stress can impact hormonal and reproductive health is a condition called relative energy deficiency syndrome, or REDS. And this is a situation where energy or caloric intake is insufficient to meet the needs of physical activity. And that can lead to the absence of menstrual cycles and stress fractures due to women being in a low estrogen state. So, images of people that come to mind with this condition or that are susceptible are gymnasts, ballet dancers, marathon runners, and we also see stress impacting hormonal and reproductive health in similar ways when women are severely calorie restricted, whether it's due to disordered eating, like a condition with anorexia or bulimia, or other states of severe malnutrition. And so these conditions will lead to something called hypothalamic amenorrhea, where starting with the hypothalamus in the brain, the system that's designed to help regulate the menstrual cycle shuts down. Then women stop ovulating, getting their periods, which of
Oh,
course
wow.
affects fertility and other things. But I do think the word stress generally has a negative connotation, but it's important to remember that not all stress is bad. I think of it as a Goldilocks and the three bears situation. You don't want too much, but you don't want too little. And it depends on whether stress is acute, so it might be sudden in onset and time limited, or it might be a chronic situation and that might have more of a deleterious or negative effect. And the response to stress is going to be highly variable. It depends on a person's individual genetic factors and just their own individual coping strategies. How you perceive stress is going to be very individualized, and how you respond to stress as well.
So you think that what like changes on lifestyle can improve that, or like if we have like people is listen to that and say, oh my God, I just got a cancer diagnosis, or I just going through this journey, what can I do on my lifestyle to change to help
Right.
that at that point?
And that's when we incorporate the pillars. And obviously, it's not going to be a simple fixed solution because,
Yeah,
anytime someone has a cancer diagnosis, of course, your survival and mortality become like at the forefront of
yeah,
your focus and your concern. So it's not like getting a good night's sleep is
yes,
necessarily going to take that away. A cancer diagnosis requires a lot of treatment, whether or not it's chemotherapy, radiation, surgery, a combination of those things. But I think that how you may or may not respond to those treatments and can also be improved by incorporating healthy lifestyle, choices. And I know you asked some about supplements, and we can talk about that later on. down in the conversation. But, again, it's really sometimes when things become overwhelming, people get paralyzed by it. So having sort of a way to simplify how you manage certain areas of your life sometimes can reduce some of that stress and being able to, I wouldn't say distract from a cancer diagnosis, but say, okay, what am I going to do to help have the best outcome I can have?
Yeah.
Eat better, sleep better, move your body, not just for physical health, but for mental health. Stress management strategies, whether or not it's sort of mindful meditation,
Mhm.
yoga. I mean, I know some of those things people kind of roll their eyes at because they're like, I'm not going to just do 20 minutes of yoga and all of a sudden I'm going to be this new person and be fixed. But, habits form over time and change doesn't happen overnight. So it's really this isn't just like a one-time thing. This is lifestyle behavior change that is meant to be incorporated into your daily life, become a routine, a way of life, and really just kind of moving away from the unhealthy, behavior choices.
Yeah. And you know what? And it's amazing how you hear this all the time, right? You know that like if you are not in a situation where you have to be worried so much about it, you hear this all the time. Mindfulness, meditation, yoga, breathing, all these things. And until the moment that your life goes upside down for some reason, not just
Right.
necessarily because a cancer diagnosed, but because a loss on the family, something that really creates this kind of like a acute stress is when you start actually making changes, right? So is when you start to see, why didn't I start doing this healthy lifestyle when I was 10 years old? And why do I have to wait now that I'm facing a disease or something kind of really stressful condition before we start
Right.
making changes in our lives, right? So I know
I
that's one.
mean, we're all human, and that is a very common scenario that it takes a significant life-altering event
Yeah,
to institute change. And honestly, for me, I think for a lot of midlife people, watching our parents age is a huge impetus for taking control of your health because you kind of get a window into your future as you see how your parents age and the health struggles that they have.
yeah,
And you start to say to yourself, well, I don't want that to be my future. What can I do now so that I, age better than my parents? And honestly, for me, that was part of it as well.
yeah,
And having, a young child, then you want to be healthy for them. So a lot of people, it's like, what's your why? And that's a question we ask of our patients is what motivates you to be healthy? And almost every time it's so I can be, more active and healthy for my children or, really to be available for my family.
yeah. That's,
So,
that's
yeah.
a very great point. So, is certain foods or nutrients you consistently recommend for hormone balance if we start moving into this like perimenopause and menopause role?
Right. Well, as I mentioned earlier, there are over 50 hormones that are produced in the human body that serve as chemical messengers that affect a wide variety of functions, and our bodies are designed to keep our hormones in balance. So, it's a complicated interaction when it comes to hormonal balance. And fortunately, most of the time, our bodies do a good job of keeping things in balance. So, when it comes to nutrition, I don't like to overcomplicate things. I do think you can break it down into more simple recommendations. Perhaps not specifically for hormonal balance, but for overall general health. A couple of exceptions, of course, would be in the case of diabetes. Another exception would be in the case of electrolyte repletion for athletes, especially endurance athletes, and especially if they train and compete in extreme weather conditions, such as the heat and humidity of Florida. So lifestyle medicine promotes a whole foods, plant predominant diet by incorporating fresh or even frozen fruits and vegetables, whole grains, healthy fats like nuts, seeds, avocados, olive oil, and then lean proteins that are primarily plant sources, such as legumes, which include beans and lentils, and then tofu and tempeh and nuts and seeds. And then even certain whole grains are a good source of protein, like quinoa, rolled oats, and even some vegetables are a good protein source. And there's so much evidence to support its health benefits. There's a lot of debate about plant versus animal protein, we like to have our why for why we're recommending what we recommend. Most people across the board will say fresh fruits and vegetables. There's no argument as to whether or not people should be consuming healthy, fresh fruits and vegetables and staying away from ultra processed food with added sugar and added salt. I don't think there's any debate about that. Healthy whole grains, healthy fats. And then I think the protein source is going to be the big source of debate. But really, when you look at the difference between animal protein and plant protein, the benefits of plant protein sources are that they are high in fiber and they're low in saturated fat. So, from a cardiovascular standpoint, that's very good.
Mhm.
Whereas animal protein tends to be high in saturated fat and lacks fiber. And so, I would say that those are the big differences. People say, oh, if I just eat plant-based protein, I can't get enough protein. And that's really not true. Or they'll say, well, plant protein lacks all of the essential amino acids, which is also not true. I mean, animal protein certainly has the essential amino acids in the ratio that the human body needs, so there isn't too much thinking about it. Whereas some plant protein sources will lack certain amino acids, but if you have a wide variety of sources, you'll get the, full complement of essential amino acids that you need from plant-based sources.
Okay. Has been a lot of no, I think protein is on vogue, right? Everybody's talking about protein intake and how you should be having certain amount of protein daily in your body, mainly when you're going through, woman after age 40 start losing muscle mass, and we want to try to really keep that up just because we know estrogen depletion is gonna not be helpful for the bones. And so that part is important. And a lot of our patients who are in estrogen blockers, mainly, right? Because all the secondary effects from AI. So what are your thoughts about, so you hear about, carnivore diets being anti-inflammatory, and like how, some of the animal protein can help more for that intake of protein just because it's easy to have, has more protein that animal, I mean, like plant-based protein. So what are your thoughts on that?
So I'm not aware that people think of animal-based protein as being less inflammatory. I actually think the converse is true compared to plant protein. Now with nutrition tracking apps, quite frankly, it's very easy to track protein content in your food sources.
Mhm.
Um, I like an app called Chronometer. It's free. There's a free version. I mean, there are a lot of paid pop-up ads that come up in it in the free version, but it's very easy to use. A lot of people use MyFitnessPal.
Yeah.
And so sometimes it's just a matter of tracking your macronutrients, so your proteins, your fats, your carbohydrates for a couple of weeks just to get a sense of what the content is in the food that you're consuming. Um, and then, it's not to suggest that people eat the same thing for breakfast, lunch, and dinner every day
Uh-huh.
in and day out. I like to do like a mix and match strategy where it's almost like, going to one of those, convenience food places like Bolé or Fresh Kitchen or something where you have your base with your grains and then you add in your protein and you have your vegetables, and just mix and match in that way.
Mhm.
But yeah, no, I think that for people that really need to know what their protein intake is, using an app, at least for a temporary period of time, can be extremely helpful.
Yeah, yeah, I use that and it's really helpful. And that's usually what I recommend to patients. So it's pretty easy to use. How do you approach things like intermittent fasting?
Yeah, so when it comes to nutrition and dietary recommendations, my approach is several fold. So, first and foremost, you have to tailor it to the individual. It's got to work for that person. So you have to start by meeting somebody where they are.
Yeah.
So, what is their current state of nutrition? Um, Second, my recommendation is that it has to be sustainable for that person. So, I'm not going to recommend a plant-based diet if someone finds it impossible to stick to that type of diet. A lot of my recommendations, I like to provide some education and rationale for why I'm recommending what I'm recommending. But also, change doesn't happen overnight, as I said. It takes time. So the third thing is it takes time for habits to form. It's often easier to introduce healthier food options before you remove the less healthy options. Otherwise, people will start to feel deprived. It can really derail progress in making healthy changes. So, like I said, a lot of my approach is to provide education. I don't want to come across as being very preachy or, dogmatic. Um, and then, as I explained, I do like to explain to my patients why plant protein has health benefits over animal-based protein sources. The ones that I explained with the saturated fat and fiber content. As we know, saturated fat has LDL, which is considered to be the bad cholesterol, which can cause atherosclerotic plaques and artery wall narrowing, and then that can have the downstream effect of leading to high blood pressure and increase other cardiovascular complications. And then, the high fiber content really helps you, it helps you poop out your cholesterol and your LDL, and it also helps to feed a healthy gut microbiome. It slows the absorption of glucose, so you don't get those glucose spikes with your meals. And then the glucose will travel further downstream to feed the gut bacteria. Um, and then did you mention intermittent fasting? Yeah. So intermittent fasting, I personally prefer time restricted eating as an approach over the more stringent form of fasting where you alternate severe calorie restriction with, your typical calorie intake. There are definitely physiologic and metabolic principles behind why alternate day fasting can help with weight loss and body composition. But from a practical standpoint, I think it's an approach that's really harder for most people to comply with. For me, I'm physically active. I exercise every day. There's no way I would ever be able to do intermittent fasting because I just couldn't meet the physical demands of what my exercise involves. And so if I'm working with an athlete, really that approach is not going to work for that individual. You can't starve yourself and then go work out for 2 hours. It's just not going to work. So this is an approach that needs to be individualized. And the other thing is that people can be their own study subjects. There's a lot of debate about how intermittent fasting works for men versus women. And there are some experts in the field that feel that intermittent fasting is not as beneficial for women. Um, so just because a person decides on one approach, it doesn't mean that it's stuck with that plan forever and they can't change it if it's not working for them. So I have had people that have wanted to try intermittent fasting to see. And as long as I don't feel like somebody's harming themselves,
Mhm.
then I think it's reasonable to try and see how it goes and then reassess.
Got you. What is your take in popular supplements for women's health, like magnesium, maca, those type of
Yeah.
supplements? Yeah.
So the one supplement that I do consistently recommend and I personally take is creatine monohydrate. But that's for me coupled with strength training. And really the benefit is for increasing muscle mass and strength and mitigating muscle loss or sarcopenia as we age. Creatine's also been demonstrated to help with bone and cognitive health and even mood. So I definitely recommend that really for pretty much everybody that I interact with, unless they have,
Kidney.
kidney disease, there are some concerns with that. You know, dietary sources come from animal protein. So, I am plant predominant. So, for people that are vegetarian or vegan, it definitely can be beneficial. And then, women, of course, have lower skeletal muscle mass than men. So, they have lower creatine stores. 95% of creatine is stored in skeletal muscle. And so it can also be beneficial for women. But so in general, I'll say I'm not a big proponent of supplements for a couple of reasons. So, one, most people can get the nutrients they need from following a healthy diet. There are dietary reference intake recommendations for certain vitamins and minerals, and people can certainly have deficiencies due to things like dietary restrictions or problems with intestinal malabsorption. Women during the reproductive years, if they have heavy menstrual cycles, can have iron deficiency anemia. Certainly, folic acid supplementation is recommended prior to conception and during pregnancy because it's been shown to reduce the risk of neural tube birth defects. And so there's definitely a role for supplements of some vitamins and minerals in certain situations. And I do take, vitamin D, I take vitamin B12, I take an omega-3 fatty acid supplement. So I'm not completely anti-supplement. But the other caveat or concern with supplements is that the supplement industry is not FDA regulated. They're not held to the same standards when it comes to quality control compared to, prescription pharmaceutical drugs. So supplements cannot state that they are for treatment, prevention, diagnosis, or cure of disease. And like I said, there's lack of regulation. So there are ways that you can ensure you're getting a quality supplement. So one way is to know if supplements undergone neutral third-party lab testing, or it has a certification label to ensure that quality standards have been met. And there are a variety of different certification labels, and they will be on the bottle if they have received that certification. So one certification label is the National Sanitation Foundation's Certified for Sport. It's NSF. And that's a testing program that helps to confirm that sports supplements and sports nutritional products don't contain substances that are banned for athletic competition. Um, Consumer Lab is a company that we use to vet supplements. It's a physician-run company. They contract for testing of supplements and other consumer goods by using neutral third-party labs, and then they publish reports based on these results. So you really need to be an informed buyer when it comes to buying supplements. I feel like everybody's social media feed probably is flooded with ads all the time about supplements that are claiming to do X, Y, and Z and cost hundreds of dollars. And, we're triggered to think that if something's expensive, it must be good. If something's good, more must be better. There are supplements on the shelves that have doses way in excess of what's recommended, and can potentially be harmful. So you really have to be an informed consumer and beware when it comes to purchasing supplements. And I do think there tends to be an over-reliance on what people think supplements can do for them in the absence of a known deficiency. Um, Scientific research is much more limited when it comes to supplements compared to FDA-approved medication. Like I said, they're just not subjected to the same rigorous multi-step process to be approved for use. For a drug to go through FDA approval, it starts with development, then they do animal studies before they move to clinical trials in humans. First, there's a small sample of humans to make sure that it's safe
We have,
before you
yeah.
you expand the groups to make sure it's effective, looking at dosing, side effects, all of those things, and that takes years to complete. Um, so you asked about MACA, and I'm going to go through a couple others, but I get a lot of questions about supplements, especially to help with sleep.
Yep.
I find a lot of people take melatonin regularly, and not just to manage travel-related jet lag, for which it's really intended. They actually often take more than the recommended dose, which is 1 to 3 milligrams, and the higher doses can actually lead to next day drowsiness. So it's sort of a self-defeating situation. Um, so some supplements, first and foremost, you want to try to incorporate healthy sleep habits, but I have recommended L-theanine, magnesium, ashwagandha, and valerian root, just to name a few. And there's like valerian root tea that I think some people may be familiar with. But for magnesium, I would say also there's a lot of confusion about what type of magnesium to
Yeah.
take. If you look, there's magnesium citrate, there's magnesium oxate, there's magnesium glycinate. Like, what do you take?
Yeah.
So, when you look at the different forms of magnesium, some are better absorbed, some have more of a laxative effect. Magnesium citrate in high doses can have a laxative effect. Magnesium hydroxide is known as milk of magnesia. That's used for constipation. And then the dosing amount, magnesium is actually considered to be a shortfall nutrient. A lot of people don't get enough magnesium in their diet, so I'm not opposed to people supplementing. The daily recommended intake is 320 milligrams, and then really not more than 350 milligrams unless you have a known dietary deficiency. So, for sleep, the ones that have been suggested are magnesium glycinate, threonate, citrate, and oxide. But in studies, magnesium actually hasn't been shown to necessarily improve sleep quality. It just might help people fall asleep faster in people that have insomnia and have trouble falling asleep. But in terms of overall symptom approval, studies have been mixed with magnesium. And then Maca is Peruvian ginseng. It's an adaptogen. And honestly, I don't get a lot of questions about adaptogens. I don't know if your patient population is different. I don't personally find that a lot of my patients take them. And so I'm actually not that well versed in adaptogens. Again, I like to emphasize this six pillars of lifestyle medicine, and getting nutrients from healthy food over taking supplements whenever possible. But adaptogens have been used in Asia for centuries. It's not like a new thing. They're plants. Supposedly, they help with stress response by blunting the cortisol effect. And so there have been reported benefits for taking different adaptogens for energy, for cognition, for anxiety, even vasomotor symptoms. But you have to be careful. Some of them are not meant to be taken if you have certain medical conditions or take certain medications.
Right.
For example, if you have a thyroid condition and you're on medication or you're on a blood thinner. So, I think that people assume that if something's on the shelf, it just automatically makes it safe because you don't need a prescription for it.
Okay.
But there are a lot of potential interactions. So I would say, and a lot of physicians, through no fault of their own, aren't very familiar with supplements. And I was the same person. Like I'd have somebody come in to see me and they'd have their plastic bag and open up and take out all of their prescription bottles and then all of the supplements. And I'm kind of like a deer in the headlights because I don't even know what to do with all of these bottles of things that people are taking. But people don't view supplements as medication. And so a lot of people will neglect to share that they're taking these things. And I think it's very important to inquire about what people are taking, both prescription and over the counter.
That was very good. Um, what are you, sometimes you have, if we go back a little bit about talking, when you were talking about magnesium, sometimes it's some magnesium that has everything on it. Like, you have forms of magnesium that claim to have all of it. You
Right.
are not taking all of it. So what are your thoughts on that?
So I really use Consumer Lab as a guide. I view it as a very trusted source to vet supplements. It's not comprehensive. I mean, there are millions of supplements on the market, but at least I can go to that as a source to say,
Right.
this has been tested by neutral third-party labs. It has in it what it says is in it,
Okay.
and it's free from harmful contaminants like heavy metals, for example.
That's very good. And then we go into the hormone positive breast cancer diagnosis and supplements, right? Again, I was telling you, like before we start the podcast, like how this is like, the majority, the patients I see is patients who has been going through breast cancer, are going through breast cancer, and a lot of them are hormone positive. So they've been on these AIs or tamoxifen, and they having all these symptoms, right? Like, joint pain, hot flashes, lack of sleep, depression, low libido, the whole 9 yards.
Right.
And many times I feel like, oh my God, what can you do that is safe for no breast cancer recurrence, but to really have a better quality of life? Because a lot of them just give up. Some of them are like, I'm not doing these medications anymore because my
Right.
quality of life is worse, that it's just worth the risk and then going to these medications. So,
And that's a very important point that you bring up is, everybody has their own personal risk benefit line that they draw in the sand of what's acceptable to them. And quality of life is a huge factor in determining what individual risk benefit is. I mean, you as a healthcare provider can lay out all the risk benefit, But at the end of the day, the patient gets to decide on some level. And, you brought up vaginal estrogen earlier. So vaginal estrogen 100% is okay to use with a breast cancer diagnosis,
So glad you said that.
receptor positive or otherwise. It is not systemically absorbed. It's not shown to increase breast cancer recurrence or affect, survival or anything. I would say, one of the books that is just so well written on this topic is written by an oncologist named Avram Blooming, and it's called Estrogen Matters.
Yes.
And he actually, so he's an oncologist, and his wife had breast cancer. And so some of his interest in pursuing research in this area really stemmed from the fact that as a patient, she was miserable, like all of your patients, and like kind of begged to be put on hormone therapy. And through that emerged a lot of research showing that actually estrogen therapy doesn't worsen prognosis, doesn't affect recurrence. Even, and it's confusing because, estrogen receptor positive, you would think that giving someone estrogen that would affect their recurrence. Um, and so, it's a very long separate conversation around that, and certainly one that needs to be had with an oncologist. Most women naturally are fearful of any hormones after a breast cancer diagnosis because there's so much of an association with hormones. I think the biggest interesting thing to think about with breast cancer is that if estrogen causes breast cancer, why is it that women are diagnosed after menopause at an average age of 62 when they have low levels of
Right.
estrogen?
Yeah, I know.
And so, anyway, that's a whole separate conversation. So, as far as supplements go, current evidence does not support the routine use of dietary supplements for prevention or treatment of hormone receptor positive breast cancer. Some supplements actually can cause potential drug interactions that might change efficacy or even cause drug toxic effects. So again, this is definitely a discussion that a woman needs to have with her oncologist. It's going to be important for them to share any over-the-counter supplements they may be taking. I'm not an oncologist, of course, but the considerations around treatment are not just going to depend on hormone receptor status, of which there are several, but also, your histologic type, your stage, need for adjuvant treatment in addition to surgery. Things like antioxidants like vitamin C and E have been looked at. There's not really sufficient data to recommend for them, nor for vitamin D supplementation. There has been concern raised by the American Society of Clinical Oncologists for certain ginseng extracts in hormone receptor positive breast cancer due to potential estrogenic effects. Um, and then I do want to talk about soy a little bit. There's a lot of misconception about the risks of soy consumption in food. So, soy isoflavones are found in soybeans and soy-derived foods like tofu and tempeh. And, the soy isoflavones chemically resemble estrogen or estradiol that can bind to estrogen receptors. And, they can either exert estrogenic effects or anti-estrogenic effects. And so, but when it comes to soy and food and breast cancer, there's actually been an association of reduced risk of breast cancer, especially in populations where there's high dietary intake throughout the lifetime. And in East Asia, especially in Japan, it's been very well documented
Mhm.
that there's a reduced incidence of breast cancer in that population. So the American Cancer Society specifically states that soy and foods appears to be safe and actually could be beneficial for breast cancer survivors for reducing risk of recurrence and overall survival. But at the same time, they say soy supplements, um, they caution against using supplements with soy because of concerns about breast cancer risk. And it's not clear to me
No.
why the soy content in a supplement would pose different risks from the soy content in foods.
Yeah.
But these recommendations really come from the available data around this specifically.
And that's the thing, right? It's like you, and we can have a whole hour conversation about hormone replacement in breast cancer, which I find it fascinating and kind of glad that to hear that you open to that because you know how many patients actually I tell them go talk to your gynecologist about it And some of
Right.
the gynecologists are like, absolutely not. You know, you cannot do vaginal estrogen. You cannot do, don't even think about any hormone replacement.
Right.
It's so
Well, and then I will say patients get stuck in the middle sometimes if there's disagreement between the oncologist and the gynecologist also. And so I would hope that oncologists nowadays that are okay with vaginal estrogen are comfortable prescribing that for their patients and don't have to rely. And I'm not trying to be critical of gynecologists. This we could also talk about the Women's Health Initiative study ad nauseum to help us understand why there's so much confusion and hesitation around hormones in women. But I think that we're finally,
moving
shifting
away.
over to the right side of that study.
So if we go back into a little bit of hormone replacement, so we know, like if you have again your menopause woman diagnosed with cancer, and you're thinking, no, let me reverse that. So you have your menopause woman, no cancer
Hmm.
related, just menopause.
Hmm.
Then you're looking into hormones, right? So you're looking into hormones to see for hormone supplements. So again, it's a lot of controversy about, some gynecologists is like, no, I don't need to be looking at your hormones. We don't do hormone testing. And it's like how you know that your hormones are low if you don't do hormone testing, and there are if you're in hormone already supplement, or like, sorry, hormone replacement is like, we don't need to be checking your hormones at any point because they're gonna be all alterated. So I'm like, will you just kind of, what are your thoughts on that?
So that's actually true. So many people want to check their hormone levels, but there's really a limited role for checking hormones. We really use symptoms as a guide to recommend and offer treatment that may be related to hormonal deficiencies more than hormone levels that are assessed by a lab, because typically levels don't necessarily correlate with symptoms. When it comes to perimenopause and menopause, there's actually a good validated symptom questionnaire called the Green Scale that takes a whole list of symptoms, and it's not just the classic ones of hot flashes, night sweats, and vaginal dryness, but joint pain, muscle pain, mood related issues, sleep, urinary symptoms, a whole scope of symptoms. And basically, women will look at the symptom scoring and say, I don't have any of those symptoms at all, or I do have those symptoms and they're either mild, moderate, or severe. You get a score for each of those, and then you tabulate it, and the composite score is such that if it's higher than a certain number, it suggests estrogen deficiency as a cause of those symptoms for which hormone therapy may be beneficial. So we really like to use that over a level. Number one, in premenopausal women, your estrogen levels are going to fluctuate all over the place depending on where you are in your cycle. And in a postmenopausal woman, they're going to be universally low. We know that. We don't have to check your hormone levels if you're postmenopausal. Your estrogen level is going to be low. So I will say there are certain situations where checking hormone levels may be helpful. So one would be potentially in a premenopausal woman who's not getting her periods because either she has a progestin IUD or she's had a hysterectomy, and we want to assess whether she's postmenopausal. But still, you can use the symptom score and not check hormones. And if you want to have a conversation around the benefits of hormone therapy, risk benefits, and alternatives, you can do that without checking levels. A second scenario may be in a woman who's taking hormone therapy, but she's not having relief of her symptoms. It might be helpful to check a level before you alter her dose or increase your dose. It may not be an estrogen deficiency in that situation that's causing her symptoms, and you have to look at other causes. So that may be helpful. And then, for a woman who's taking testosterone for low libido, we do check a testosterone level prior to initiating treatment. And then we check follow-up levels after treatment has started to make sure her levels remain within a normal female physiologic range. And we repeat those labs as she has a dose adjustment for the same reason. We want to make sure her levels are in a normal female range. Unfortunately, we've seen women who've been placed on very high doses of testosterone. They have significant side effects. And then you check their levels and you come to find that they're really in the male testosterone range, which obviously we don't want. So really, those are the scenarios where I would say hormone level checking may be appropriate.
Okay.
But, in general, no. And I, agree with all of the doctors out there that are saying we don't need to check your levels.
How about progesterone?
So progesterone's probably used more in like reproductive age women when you're trying to assess if a woman's ovulating or not. We know progesterone levels go up after ovulation. So I would say that's probably used more in the reproductive age population or in sort of an infertility setting, more so than for to assess whether or not they need that for hormone replacement. Because really, the role for progesterone in a woman who's going to take hormone therapy is whether or not they have a uterus is one. So you can't just take estrogen if you have a uterus because estrogen stimulates the lining of the uterus to grow. And without taking progesterone to balance that out, you run the risk of precancer or cancer of the uterus. So women with a uterus who want hormone therapy in the form of estrogen also need to take progesterone. If you've had a hysterectomy, you don't have to take progesterone, but a lot of women find that micronized progesterone capsules taken at bedtime help with sleep. So some women will elect to take progesterone in addition to estrogen, who don't need to take it for uterine protection.
Got you. And what are your thoughts about testosterone and progesterone, oral versus pellets versus cream? Like, it's a lot of
Ye-
controversy about.
So, so progesterone cream is not well absorbed, so we don't recommend progesterone cream ever. Oral is better. So yes, so we don't recommend progesterone cream. Testosterone, there are no professional societies that recommend testosterone pellets. None. The Menopause Society, the International Society for Sexual Health in Women. Um, there's no role for testosterone pellet use. I know that it's very widely used, um, but the problem is that it typically raises women's testosterone levels much higher than normal physiologic ranges. And once that pellet's inserted and it's there for a couple of months, you can't take it out. So the effects are just, you're stuck with them, and it can take some time for that to be reversed. Um, so we recommend topical testosterone therapy, and really the only indication for it currently is really for hypoactive sexual desire disorder, HSDD, or low libido. And it's not even FDA approved for this purpose in women, but it definitely has been shown to be beneficial. Um, and so there are a couple of options. One is to use a testosterone gel that's prescribed for men, but we use it at 1/10 the dose. And the other option is to use testosterone cream through a compounding pharmacy. The only other little caveat or word I will say about testosterone, because I participate in, age group amateur athletics for women, it's a World Anti-Doping Association banned substance. It's considered to be a performance enhancing drug. And so, in the female athlete population, even if you're an amateur athlete, if you can compete at a relatively high level as an amateur athlete. It's really, at this time, considered to be banned for use in women. And the interesting thing, and I know we didn't talk about PCOS, but for the IOC, or the International Olympic Committee, it's been problematic for women with PCOS because they actually naturally have higher levels of testosterone than women who don't have PCOS. And some of them can have levels that are higher than what's considered to be acceptable to compete at the Olympic level.
Wow.
And those women actually are restricted from competition unless they take medication that will lower their testosterone levels, like taking a birth control pill, for example. But, this is a little bit of a digression and off topic, but I just, um, because of what I do in terms of my hobby, I always feel like it's important to mention that.
Would you mind to explain to our uh, guests, oh sorry, our the people who is listening to this podcast, what is PCOS means?
It's polycystic ovarian syndrome. It's a very common condition in women of reproductive age. I mean, the incidence is about 6 to 8% of women of reproductive age. It's a condition where women don't ovulate regularly. And they typically have higher than normal female levels of male androgen levels, more specifically testosterone and DHEA. And then they can have what's considered to be a polycystic appearance of their ovaries. It's not required for diagnosis, but basically, what that means is if you look at someone's ovaries on ultrasound, you'll see a lot of cysts around the periphery of or the edge of the surface of the ovary. And it's because that person's body is working really hard to develop what's called a dominant follicle so that they can release an egg for ovulation. And because the hormonal wiring is not creating that situation, they get a lot of smaller follicles that develop, and they're all kind of like waiting to be hatched under the surface of the ovary. Not every woman has that sort of appearance to their ovaries, like I said, but that's where the polycystic word comes from.
Okay, perfect. That's a great explanation. Do you guys use tools like the DASH testing, gut health panels, thyroid optimization, any of those tests?
So we don't use or recommend any of those tests. I can kind of go through. Um, oh, I'm sorry, I'm getting a phone call. Hold on a second. Let me just
No,
shut that
it's okay.
down.
That's okay.
Okay. Can you hear me?
Yeah, 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 yeah.
Okay. So, we don't currently use or recommend any of these in our practice. A Dutch test, Dutch DUTCH stands for dried urine test for comprehensive hormones. It's a commercially available test that can measure hormone levels. They use dried urine samples that are collected on filter paper. So I would say from a patient perspective, the advantage is they don't get their blood drawn to check a hormone level. Um, but right now, currently, there are no large studies or any consensus guidelines to recommend its use. And as I mentioned earlier, there's a limited role for checking hormones anyway to guide clinical practice. And it's an expensive test. I mean, it's reported to cost anywhere from $200 to $700. So I'll go into cost and that in a second. So the GI MAP test or gut health test, it's a test where you collect a stool sample and then they do DNA sequencing to identify and quantify a person's gut microbiome. So the bacterial load, whether or not there are parasites, other viruses. It's another direct to consumer test. It's not currently recommended by any professional medical society, the American College of Gastroenterology, American Society for Microbiology, Infectious Disease Society of America. And again, it's another expensive test. Reported cost range anywhere from like the mid 300s to $600. Um, we don't do any specific thyroid optimization in our practice other than using the six pillars of lifestyle medicine to optimize overall health. Of course, we check thyroid function as part of our standard lab assessment. People are paying hundreds of dollars for these direct consumer tests, many of which aren't useful or necessary. In our practice, we recommend a standard panel of labs. And if someone were to pay out of pocket for the test that we recommend, it costs around $90. It's like to check labs to assess cardiac health, diabetes, anemia, thyroid, kidney function, liver function, certain vitamin deficiencies, all of those things. And it's $90.
Yeah.
And then you're going to spend, $700 to do
Wow.
a Dutch test. It's anyway. So, you know, in medical practice, when ordering tests, and this is something that we're taught in our training, you have to ask yourself, what information are you trying to get? And what are you going to do with that information? We live in a data-driven society, in many cases for good reason. But, when it comes to spending hundreds of dollars on tests where you don't know what to do with the information, and most of the time, quite frankly, the test results are going to be in the normal range. It's just not something that we recommend.
Okay, perfect. And I know we are like have a lot of questions. So we're just kind of wrapping up here. So what would be one daily wellness habit you recommend for almost every patient?
Uh, Go to bed. I feel like it's
On
like having a
time.
toddler.
On time, right?
Get your Z's. Get your Z's. Go to sleep. Don't stay up watching something late at night on TV and get 5 hours of sleep and be miserable the next day. Go to bed. But I will say one of my favorite quotes. I don't know if you know Rich Roll. He's a pretty popular podcaster. He's an ultra endurance athlete, is a former lawyer, former swimmer at Stanford. I love his podcast. It's one of my favorites
Okay,
after yours, of
what,
course. But
what is
but my favorite quote from him, it's mood follows action. And I have it written on a post-it note. It's stuck to a mirror in my bathroom. And so really the crux of that quote is if you wait until you're in the mood to do something, you might just never get it done. Like I mentioned, I do some sort of physical activity or exercise every day. And I'll say, there are plenty of days when I don't want to walk out the door or do whatever, but I have hardwired in my brain that I will always be glad I did it afterwards. And I always am glad afterwards. I never say, oh my gosh, I really regret doing that workout. I will say, oh my gosh, I regret not doing that workout. And so, mood follows action. That's really like my favorite thing is
that?
like sometimes you've got to move first and then the mood will follow from that.
I like that.
Um,
I'm gonna
but,
apply that for sure.
but, but go to bed,
Go to bed.
get some sleep.
I know this is my deficit. It's like no matter what I'm trying, it's like God, when I'm gonna try to make it by 9 o'clock. So I have to be up, I have to be at work at 7. So I'm up at 5:30 in the morning. So
Yeah.
it's like, okay, why? And it's like my brain just don't go there. It's like I'm
Yeah.
getting better, going from 11 to 10. I'm going better.
Yes, yes. You just have to work your way backwards and start your wind down routine earlier. I mean, there are basic strategies, turning down the lights, kind of shutting off your electronics.
Yeah,
You know,
yeah,
yeah, I mean, some people will take melatonin beforehand, but I don't recommend that necessarily chronically. You want to kind of establish the behavior change, but
got you.
yeah.
Um, where do you see the future of gynecology and women's wellness medicine heading?
So let's see. Oh my gosh. A lot of the conversations we are having in medical and residency education when I was a residency program director, and even before that, was, whether or not we needed to consider creating tracks in residency programs because there's such a breadth of education and training that's packed into 4 years of a residency. So, do we need to track it so that people have a gynecology focused residency versus an obstetrics focused residency? Or do we actually need to make the residency training program longer? Because, I think when people think about obstetrics and gynecology, a lot of people think that the specialty is focused on delivering babies. But it's a highly surgical field, not just from the standpoint of performing cesarean deliveries, but also for all the gynecologic surgery that we do. And then we also serve as many women's primary care providers. So, within the scope of 4 years, learning to deliver babies, operate, serve as a primary care provider, we're also learning about all the subspecialties, including oncology, urogynecology, high risk obstetrics. Family planning includes abortion care and reproductive endocrinology and infertility. And as I'm sure you're also aware, perimenopause and postmenopause care has been a highly neglected area of education. So there's been a lot of attention given to the need to restructure education around this subject, not only for OBGYNs, but for all healthcare providers who care for adult women. I think it's important to be reminded that when you consider that the typical life expectancy of a woman is well into her 80s, and that adulthood starts at age 18, if the average age for menopause is 52, that means women are spending half of their adult lives in their postmenopause years, and no one's getting any education about how to help women during this time in their lives.
That's very good. And then to wrap up, what is any new tools, technologies, or therapies are you excited about?
Well, this one's kind of a personal one, related to my physical activities.
I guess so.
Yeah, so I, I was always a runner first. That was my first love, and I've had a lot of running related injuries over the years. I have pretty bad knee osteoarthritis, so running has become very limited for me. So a tool that I really love for me personally now, it's called the Lever System, and I have no financial investment in this company. But basically, what it is, it's a device that attaches to a treadmill. It has a pulley or a lever system incorporated into it so that you clip a long bungee cord and run it through a special pair of shorts that you wear so that it actually lifts you up a little bit. It offsets your load. And that you can run at a reduced weight. So it reduces some of the impact of running. You can actually take off as much as 45 pounds. I feel I've done that before.
Wow,
I feel like I'm running on the moon, but
that's so
I
cool.
usually run at about 85 to 90% of my body weight. And I try to do that once a week just so that I'm not constantly, pounding on my joints. And I'll do other, regular runs at full body weight without it. But being able to incorporate that into some of my running has really helped to decrease my injury risk and has just enabled me to do something that I really like. And I bring it up because there's been a huge movement toward rucking with weighted vests. And I'm not trying to be negative about that. It's just not a
Well,
strategy that's worked for me.
yeah.
See, so many people are walking around with these weighted vests, and I personally, and I've tried it, and I just think that for me, the added weight and the impact that my joints have felt, it just put too much stress on them and actually has created more problems than benefits. So for me, I do the opposite. I make myself lighter
Oh, wow. I want to
to
know
run
more
around
about it.
rather than make myself heavier.
Yes.
And so for people that are exploring rucking as an exercise technique and find that it's not working for them, maybe they need to take the weight off rather than add more weight on.
Yeah, yeah. Have you ever tried like running in the pool?
Yes, oh my gosh, I just find it so boring. And I can never get my heart rate up, really from running in a pool. Obviously, there's no impact, but you also, without having the feel of the ground under your feet, it's
It's
just not the same running mechanics as actually having foot landing. So being able to run with a device that makes you lighter and lessen some of the impact, for me personally, has been super helpful.
That's great. And then the device doesn't necessarily has to attach to a treadmill or
It does. It has to attach to a treadmill. I think they have sort of a guide to say what treadmills it's compatible with, but I would say it's compatible probably with most standard treadmills.
that has been super informative, Dr. Byun. Thank you so much. Again, I could have you here for another hour. We have to do part two. So many things that we want to ask, but that was so helpful. I think the audience is really going to enjoy this.
Well, it was a lot of fun, so thank you for inviting me.
Absolutely. Thank you so much, and good luck with your future physical. What is happening? You doing another ultra?
Not anytime in the near future. Now I'm actually doing a lot more strength training. I didn't mention like how important that is for women as they age, but I've incorporated that more than doing like full on hours of cardio, and I've really enjoyed that.
Yeah, and then I can guarantee you that the next time you do like a marathon, if you do, you it's gonna feel so much better because you're stronger. So definitely,
Yeah,
it's a great game plan. All right,
yeah.
thank you so much. You have
All
a
right.
good evening.
You too. Take care.
Bye.
Bye.